Hi guys, and welcome to Shalom Aleichem. So today I have a special guest on Shalom Aleichem, and that is my dad. Say hi, Dad.
Hi, everybody.
Today I decided for OCD week I would have my dad take a little OCD pop quiz. So last year I gave him some questions and tried to teach him what certain terms meant in OCD because he really didn't know. So I decided to teach him, and we did a pop quiz then, and now I decided we would do it again and see if he retained any of that information.
Okay, I'm ready.
Okay, so first questions are going to be about different vocabulary terms, and then I'm going to go on to different sort of things.
Okay.
So the first question is, what is accommodation?
That is when you do something to... Oh yeah, when like a parent does something so that the person who has OCD doesn't feel as anxious.
Yeah, that's true. That's good. Okay, number 2. What is habituation?
That is when a person with OCD is able to face their anxiety. After doing their exposures, they're getting better.
But what does it look like? What does habituation look like?
They're calmer when the anxiety is there.
I think you know what you're saying. I think you got it right. That it's habituation is when the anxiety goes down on its own.
That's right.
So.
That's right.
Number 3. What does CBT stand for, and what is it?
CBT?
Yeah, CBT.
Oh, cognitive behavioral behavior therapy.
Yes, that's
Cognitive
true.
behavior therapy. And
what is it?
It is when it's basically behavior modification.
Yeah, kind of, yeah. Number 4. What is an obsession?
That is when a person has repeated thoughts.
What else can it be?
It could be a person feels like they have to do something to reduce their anxiety.
But what is, like,
They're
what's the...
obsessed with... it could be the thoughts or actions.
Oh, kind of. It's something, it can be other things other than thoughts. Name one other thing it is. It's not action. Thoughts or
behavior.
No. An obsession is a persistent, uncontrollable thought, impulse, or image that is intrusive, unwanted, and disturbing. You're kind of getting there with this next one. What is a compulsion?
Compulsion is when you feel like you have to perform a behavior to reduce your anxiety or face the fear.
Yeah, pretty much. A compulsion is something a person thinks or behavior that they use when they have an obsession to make the anxiety go down.
Okay.
Number 6. What does ERP stand for, and what is it?
Exposure response prevention.
Yes.
Well, it's so what it means is, what'd you say? What is it?
What is it? Like, what is the therapy?
If you have a particular anxiety, you expose yourself to that anxiety until the compulsion or obsession goes down.
Okay, well,
So
the compulsions don't, well, the urge to do the compulsion, it goes down.
Right, right.
And the obsession will go down. Well, the anxiety around the obsession will go down. Okay, I'll accept that. Now, what is the SUDS level, or fear thermometer?
I have no idea.
Okay, I'll give you a hint.
I don't know what SUDS stands for.
I was about to tell you that. So SUDS means subjective units of distress.
Okay. So, does that have something to do with hierarchy?
Yes.
The SUDS level is basically how much your anxiety is, kind of a rating point of your anxiety.
Yeah, pretty much. Basically, it's a scale of 1 to 10 that a person doing an exposure will rate their anxiety on to rate how high or how low the anxiety is during the exposure. Number 8. What is a hierarchy?
Oh, that's where a person with OCD will list their fears by importance.
Yeah. Okay. What is a re-exposure?
That might be when you're doing an exposure and anxiety comes back, so you do it again.
No, not exactly. A re-exposure is when you submit to a compulsion and do a compulsion, and then you go back and re-expose yourself to that anxiety. Now, number 10. This might be a hard one. So, what significance does the phrase "ride the wave" have in ERP therapy?
It's when you are doing an exposure and the anxiety level is getting very high, and you just try and basically ride through the level of anxiety till it goes back down.
Yeah, that's it. Like a wave.
Yeah. It doesn't get time.
Now, number 11. How much time must, this is kind of like a psychology question, so hopefully maybe you can like tune back to your days in psychology class in college and kind of remember. So this is based on the information in the DSM-5. So it is, how much time must obsessions and compulsions take up for a person to be diagnosed with OCD?
How much time? I would say it's not an issue of time, but how much it affects their life to where they cannot be productive citizens.
Well, that's true, but in the DSM-5 they do have a time amount that that the person has to have obsession and compulsions to be diagnosed. Risk it.
I'll just say 75% of the day.
It's actually 1 hour.
Oh wow. Huh.
Well, when you think about it, most people who have obsessions, well, not even obsessions, but most people who have intrusive thoughts can just shake them away within
Right.
seconds.
Right.
And people with OCD take up, even like an hour is a lot of time to be thinking about an obsession or an intrusive thought.
Right. That makes sense.
So, number 12. What percentage of adults in the U.S. is diagnosed or has been diagnosed with OCD?
29%.
2.3. So 1 in 40 people. Next question. What are 4 other disorders that may coexist with OCD?
4 other disorders. Schizophrenia. Generalized anxiety and psychosis.
Well, that generalized anxiety and depression were definitely right. But so schizophrenia and psychosis are not the most common things that are comorbid with OCD, but they can be. So technically that's right too. So I'll give it to you.
Okay.
But some of the most common ones are anxiety, other anxiety disorders, major depressive disorder, bipolar disorders, attention deficit / hyperactivity disorder, ADHD, feeding and eating disorders, autism spectrum disorder, a tic disorder or Tourette's syndrome. And then several disorders that tend to coexist with OCD also have a lot of similarities to OCD, and those would be body dysmorphic disorder, hoarding disorder, trichotillomania, hair pulling disorder, excoriation, which is skin picking disorder, other related obsessive-compulsive and related disorders, e.g. body-focused repetitive behavior disorders such as nail biting, lip biting, cheek chewing, and obsessional jealousy. Yeah, I was confused about that one too, but I didn't know that.
Jealousy.
Okay, so 14, and this is the last one. Among mental health disorders, OCD has the blank highest proportion of seriously disabling cases. A, 10th highest proportion, B, 5th highest proportion, or C, 3rd highest proportion.
Repeat the end of the question.
Highest proportion of seriously disabling cases.
What was the choices again?
10th highest proportion, 5th highest proportion, or 3rd highest proportion.
3rd.
Yes, that's right.
Okay.
Okay, I think that's the only fact one you got right. That's pretty good. So you got most of these right. I'll count it up when I watch the video because I wasn't counting here.
Okay.
So when I watch the video back, I'll count it up and let you know what you scored. Okay, so you got most of them right. So that's pretty good. High five. Yeah. And thank you guys for watching. I hope you're enjoying OCD week. Stay tuned for other special surprises this week. And yeah, I hope you enjoyed this video. I hope you enjoyed my lovely dad. And I'll see you guys later. Bye.
Bye.
Gator was under us this whole time. We were like petting him with our feet. Gator!
Gator!